It's time for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with the latest on maternal health. Lino?
Hello, Esther. Hello, everyone. Well, there is a worldwide shortage of blood, according to the Red Cross. 1 in 10 people donate blood, while 1 in 7 will need it someday. Experts say many patients in developing countries who require blood transfusion do not have timely access to safe blood and blood products. They say in low and middle income countries, blood transfusion is often used to manage pregnancy-related complications. We caught up with Kwaku Agyeman-Manu, Ghana's Minister of Health, who elaborates on the issue.
When we look at maternal health, there is one very basic thing that happens to mothers after delivery. We call it post-partum hemorrhaging. They keep on bleeding and bleeding. And in most instances, apart from medication, the last sure thing is to give them blood. So blood transfusion becomes very, very important to enable us fight the challenge of maternal mortality, because you can bleed to death and you have blood close by, you can save lives with it. And that is why it has become very important that we set up structures that can make blood available, process blood so that we don't do a lot of raw blood, get our distribution channels quite open and very efficient so that we can transport or deliver blood at critical times when we seriously need them to save lives of our mothers. We actually have set up what we call a national blood service. We have created 3 zones where we call centers, and then we process the blood, that raw blood, in these centers and try to distribute across country. Despite this, we encourage hospitals and facilities to try to actually source for blood from within communities and families and save them. We've helped our facilities to create a semblance of blood banks, those smaller ones, in several areas, so that we always have blood in several places in our country. Apart from this, we've started actually setting up our drone centers that have started flying blood to hard-to-reach areas in emergencies, in critical times.
Now, Temie Giwa Tubosun is founder of LifeBank, an enterprise in Nigeria. She discusses improving timely access to safe blood through her business.
Nigeria has one of the highest maternal mortality in the world, and the highest cause of maternal mortality is postpartum hemorrhage. And basically, if there's no access to blood, women die routinely within 20 minutes and 2 hours all across Nigeria, all across Africa, actually. So it's a huge problem: blood availability, distribution of the blood that's available, and safety of the blood that's available. LifeBank is a medical distribution company. We deliver blood system find donors so that there's enough donors and there is no stock of these supplies.
A study published recently in the medical journal The Lancet Hematology compared blood availability estimates compiled by the WHO and found that of the 180 countries analyzed, 107 had insufficient blood to meet their needs. Now turning to asthma, the disease can actually be controlled with an inhaler or sometimes with medication. When neither works, it might be that the patient does not have asthma. VOA's Pearson reports that researchers have found another disease with the same symptoms as asthma actually starts in the stomach.
For more than a decade, Michelle Skeldon kept getting stronger and stronger medications for asthma as her breathing became more and more difficult.
Just to walk up maybe 5 steps, was extremely hard for me, and it was hard to breathe. And at one point, I was actually on oxygen.
After she developed a serious case of pneumonia, her doctor sent her to see a gastroenterologist.
What we try to do is take a step back and say, is there a root cause of those lung symptoms, and is it possible that this isn't asthma?
Tests showed Skeldon's stomach acid was flowing back into her esophagus, the tube that connects the mouth and the stomach. She did not have asthma disease, often called by its acronym GERD.
That can cause a slew of symptoms, including cough, hoarseness, shortness of breath, pneumonias.
Risk factors for GERD can include obesity or pregnancy, smoking, eating fatty or fried foods, and drinking coffee or alcohol can increase the symptoms. Losing weight or making other lifestyle changes can help. So can medication or even surgery to prevent stomach contents from reaching the lungs.
As soon as I had the surgery done, it was a totally different world. You know, the coughing stopped. It was amazing. It was like night and day.
Skeldon says her new diagnosis came as a relief.
It was kind of like I was vindicated when they looked at me and they said, it's not asthma. You have acid reflux.
Left untreated, GERD can lead to permanent lung damage or even esophageal cancer.
If a patient is having more and more symptoms, is requiring more and more medications, or is not responding to those medications as well as they previously did, that should set off alarm bells that some other condition may be causing their symptoms.
Skeldon's life is once again back to normal with no shortness of breath. Carol Pearson, VOA News.